It's Dr. Sandra Laura Cremers, and in the time of pandemic, I just want to show you how to take care of a metallic foreign body. We have a wonderful patient today who's given me permission to just videotape the removal and the actual foreign body. He was welding some metal at home and he had glasses on. He was doing very well, but it went under his glasses. So this can happen. At our house, we try always to use swim goggles whenever we're doing anything with metal or even nailing, using a hammer and nails, or even doing woodwork, because we can sometimes see the particle go under the eyelid. So let me show you what it looks like. You can just point there. And so we gave him some anesthetic. This is one of the most painful things you can have in the world, because the cornea is the most sensitive part of the body. So you can see the piece of metal, the white area around it, it's starting to get infected. So we're going to get right on top. You can see his eyes really red. He has a large episcleritis reaction to it. And so you can turn this way. He has anesthetic. We gave a drop of antibiotic. We take a needle. Okay, this one actually is 21 gauge, but you can use any needle. Well, the surgeon or the doctor can do this. And so what we're going to do, and you can go either, why don't you turn that way, Joanne, so you can do maybe both of us. And we're just going to gently have him look straight ahead. So this is under a microscope. Mira recto si puede. Muy bien. And we're just going to flick off the metal here with just the needle very carefully, and we just take it off, and we're going to try to get the rust. So there's already rust underneath, and so what I'm doing is using the needle to just carefully take out the rust, and then we're going to use something called a diamond burr to take out the rust. So I'm going to get a Q-tip here that's all sterile. And then when we're done with this, we're going to make sure there's no rust left, because that can be very irritating. Mira, Diva. Mira, Diva. Just cleaning the fornix to make sure there's no pieces that got away. Okay. And then we'll start an antibiotic until the defect is healed. So this is called an algae brush. And it's what we call a diamond burr brush, and so we use this to get rid of the last bit of rust. The reason why we try to get rid of the rust is really two reasons. Number one, we don't want the scar, and number two, in some people it can cause issues down the line with kind of the discomfort coming back. So we try to bring it out. We don't want to leave that metal rust. So this one is basically working. Okay, here we go. So you can also turn again to kind of get both the camera and maybe what I'm doing too, so you can see. Mira recto. And we just do this until we get rid of the rust. Sometimes we have to go back to the needle. And I've never had anyone puncture the cornea through with the brush. You could do the needle, you could puncture the needle through the cornea. That's what we just use, that very tangentially. We don't go straight in. And then we just take a look at the hole here, make sure it's all gone. And right now I don't see any type of rust, so he looks good. Okay, see you soon. So what we're going to do is, we don't usually patch, put a contact lens unless they're in a lot of pain. But we're going to see if we can come back tomorrow. If not, we might put a bandaged contact lens in for the night, but we'll have to see him tomorrow, because you don't want this to get infected. So he'll be getting some very strong antibiotics, and then once that antibiotic has helped and the epithelium has healed, then we sometimes will give steroid to help prevent a scar from forming in the cornea. Luckily, this wasn't right in the center of his vision, so he should do great. Okay, I hope this helps. Thank you.